What does informed consent for topiramate, otherwise known as Topamax, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as concepts of safety prescribing when clinically appropriate. And I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. So today we're talking about topiramate, otherwise known as Topamax. So topiramate works by basically reducing neuronal cell excitability, and it does this through a few different mechanisms. One is that it's going to be enhancing GABA activity, which is our calming neurotransmitter. It's going to be inhibiting glutamate activity, which is our excitatory neurotransmitter. It also blocks voltage-gated sodium channels, as well as carbonic anhydrase. It was originally developed as an epilepsy medication, so it's FDA approved for the treatment of seizures, both as monotherapy, meaning alone, or in conjunction with other anti-epileptics. It's also used for migraine prophylaxis as well as weight loss when it's used in combination with phentermine. It certainly has a number of other off-label uses as well, including for a number of psychiatric diagnoses. So it can be used as a weak mood stabilizer for bipolar disorder. It's also used for substance use disorders, so things like alcohol use disorder as well as cocaine. It can be used off-label for borderline personality disorder, PTSD, anxiety, as well as binge eating disorder and bulimia nervosa. Common side effects are going to be numbness and tingling. This is pretty common once you get overdoses of 50 milligrams. There can be cognitive issues like cognitive dulling, brain fog, as well as fatigue, dizziness, drowsiness. There can be a decrease in appetite, hence the weight loss effects, as well as other GI side effects like nausea, diarrhea, constipation. Sometimes it can worsen anxiety. There can also be changes in taste and blurred vision. Potential adverse effects include things like acute angle closure glaucoma, which is a dangerous eye condition in those who have a narrow anatomical angle. Because of that carbonic anhydrase activity, there can be metabolic acidosis, and there is an increased risk of developing kidney stones. There can additionally be the risk of SI, as well as Stevens-Johnson syndrome, which is a very dangerous skin condition. There can also be issues with hyperthermia, so issues with temperature regulation, as well as birth defects. It's not safe for use in pregnancy due to the risk of developing cleft lip and cleft palate. And then lastly, there is the risk of decreased bone mineral density over time. I find that this medication can be helpful when used for multiple different indications. I don't usually use it as monotherapy for any one condition, but if someone has an alcohol use disorder and migraines, then it could be a good option to try and treat both with one stone. If there's any other psychiatric medication that you want to hear me go through the informed consent process, then put that in the comments below. I'm also putting together an email list for those of you who are interested in my content because I may have future courses or offerings or resources, and I want to be able to communicate directly with you all about those things. So if that's you, send me a DM with your email, and I'll see you in the next one.